How does mass incarceration impact public health? Have you ever thought about how mass incarceration affects not just those behind bars but also the health of entire communities? This is a significant issue that intertwines crime and public health. Let's break it down. Mass incarceration leads to high rates of chronic illnesses among incarcerated individuals. Conditions like diabetes, hypertension, and HIV/AIDS are common. Mental health issues, including anxiety and depression, often worsen in prison due to poor access to care and the stressful environment. Many people enter prison with existing health problems, but the prison conditions can make these issues even worse. Overcrowding and limited medical resources contribute to deteriorating health. From a sociological perspective, mass incarceration disproportionately impacts marginalized groups, particularly Black, Indigenous, and people of color communities. These groups face higher arrest rates, which adds to existing health disparities linked to social and economic inequality. For example, Black individuals make up a larger portion of the incarcerated population compared to their numbers in the general population. Those with low incomes or unstable jobs are more likely to be arrested repeatedly, creating a cycle of poor health outcomes that extends beyond prison walls. The effects of mass incarceration ripple through families and communities. When large numbers of people are removed from their neighborhoods, it disrupts social networks and economic stability. Families of incarcerated individuals often deal with increased stress and economic hardship. Communities with high incarceration rates tend to have more mental health issues, substance use, and communicable diseases, which poses a broader public health challenge. Incarceration also drives health inequities. It limits access to jobs, housing, and social services for those who have been incarcerated. This lack of access affects long-term health and well-being. The stigma faced by formerly incarcerated individuals complicates their reintegration into society and their ability to access health care. Efforts to reduce mass incarceration, like decarceration policies and improving health care in prisons, are seen as public health strategies. Reducing prison populations can help ease overcrowding and improve health conditions inside facilities. Community-based alternatives to incarceration and better support for reentry can lessen the negative health impacts on individuals and their communities. Mass incarceration contributes to poor health outcomes in many ways, affecting both the physical and mental health of those incarcerated and creating broader social consequences that deepen health disparities in marginalized communities. Addressing this issue is essential for both criminal justice reform and improving public health.